Welcome to Under the Hood.
I'm Dr. Alex DeGrotto, your pelvic floor physical therapist.
And I'm Dr. Rebecca Howard-Udy, your sex and relationship therapist. Good morning, Alex.
Hi, how are you?
I'm good. How are you?
I'm doing great.
So I love to request topics of you. I think like every time anybody asks me about this podcast, what I say, which I think sounds like I don't know that people always know that it's as genuine as it is, but what I always say is I'm learning so much.
I say the same thing.
Do you?
Yes.
Yeah.
I'm like, oh, Paul can thank Rebecca for improving our relationship every episode.
Well, it's true. I learned so much.
Me
and
too.
So this topic that I want to talk about today is diastasis recti.
Yep.
Which is something that I'm personally interested in. My kids are 10 and 11 now, but they're close together. You know, they were 18 months apart. They were big babies. Like they're both 9 pounds.
Wow.
And I definitely struggled with this, as I understand it, the separation of your abs that is natural. It has to happen. But then after postpartum, having trouble knitting back together.
Yes. Okay. So let's talk about it.
So I saw a pelvic floor physical therapist for this at one point and was told like, it's just going to be that way. And then that was sort of the end of my pelvic floor PT journey.
Mm-hmm.
So I am very curious about what this actually is.
Yep.
I've heard different definitions.
Yeah.
I've heard I was told, it's been a couple years. You can't really do anything about it. It's just how it is.
All right. Let's dive in. So diastasis recti or diastasis recti. I've also heard people say diastasis recti. Who knows what the,
Yeah, potato.
Yeah, I was going to say perineum, but yes. So
that's much more.
It's just on brand for our podcast. So
tomato.
Yeah, So there's something called the linea alba, and the linea alba is the connective tissue that joins your rectus abdominis, which is your six-pack muscles, together in the middle.
Okay.
And so this line.
That's the line.
Yep.
The well-defined line.
Yes, exactly.
Yeah.
This line.
Or somewhat less well-defined.
Yes, gets sort of soft and stretchy and starts to expand as our baby grows. And we need this to happen because our baby needs space to grow inside of us. And so I think there's a lot of fear mongering, especially with social media and people trying to sell programs where they're saying, oh my gosh, you're coning and doming and tenting and all these words. And it makes people terrified of something that is truly natural.
You're pregnant.
Correct.
Okay.
And so, yes, it's true that you can absolutely be overdoing it and really not supporting the expansion and the growth. And also when people use it as a party trick and they're purposely making it happen over and over again, not great. And we do typically have people modify the way that they're kind of getting in and out of bed or whatever to minimize the pressure there.
So the coning, doming, tenting, whatever, is the thing that happens where it kind of like
exactly.
Pokes out a little bit.
Yep.
Okay. Yeah.
And so during pregnancy, even when I first started as a PT, we were really still quite up in arms about this and saying,
pokes out.
Yeah, exactly.
Yeah.
That's okay.
Sorry, I'm going back to this.
No, I thought it was totally, that is what people would use to describe it.
Yeah, okay.
And so the new sort of information or the nuance there is that, yes, your belly has to expand and grow.
Yes,
so this is going to happen. And it's not a death sentence. Just because you're noticing some during pregnancy doesn't mean you're going to have some massive separation afterwards. There's a lot of contributing factors. And as I'm not a major researcher myself, the ones that come to mind are genetics and, there's some others, but the big thing postpartum is that we used to just measure the finger widths, seeing how far apart, but that wasn't a super accurate measurement. And it also wasn't really indicative of or predictive of somebody's debility. So you could have kind of a large separation and still be functioning really well. And then other people, maybe a fairly small one, but not functioning at all. And we used to attribute a lot of back pain to it. And now, there's really just only moderate research that supports some of the stuff that we used to associate with diastasis recti. The big things that we do in pelvic floor physical therapy currently are we look at the person's pressure management, and I'm going to explain what that is. We look at their deep core, which is the transverse abdominis. So it's not even the six pack muscles, it's the deepest layer.
Okay.
And then we look at your thoracic mobility. And because a lot of times we're kind of like very afraid to move the wrong way during pregnancy. Like, don't lay on your back, don't twist, don't do any exercises with twisting. I mean, that's not like a realistic way to live life.
No.
But
No.
we end up kind of stiff.
Yeah.
And we're holding our babies a lot. So we develop this posture.
Yeah, God forbid you should like
Yeah,
move when
exactly.
they're
Yes.
sleeping or something. Yeah.
And so we work a lot in pelvic floor PT on restoring mobility, because if you think about your back being super, super stiff, that's actually impacting the front. And the deep core, the transverse abdominis, wraps all the way around to your spine. And so we actually look at the multifidi, we look at that transverse abdominis, we look at your pelvic floor and your diaphragm. That's what creates that entire canister. So I think historically we used to be kind of obsessed with safe core exercises, like no crunches, no V-ups, no planks, God forbid. But then current literature isn't really supporting that anymore.
Okay.
What it's really supporting is learning how to breathe and connect with your deep core, and doing exercises that actually strengthen you and provide mobility where you need it, because we can get really stiff and tight, and that impacts our ability to heal as well. And then
So you're saying I should be breathing during my core exercises?
Definitely, yes.
It's hard to do.
It's hard to do.
So
and
I
it's
can,
probably,
when you say learning,
yes, you have a ways to go.
well,
Yeah.
I think when I'm cued to do it,
Yeah, you'll do it.
I'll do it, but it is not instinctive to want to breathe while you're
I know,
working out your
totally.
core.
Yes,
It
so
really
true.
feels more natural to hold your breath
And
and grit your way
Yes,
through it.
exactly.
Yeah.
And then I think a lot of people also mistaken an umbilical hernia for diastasis recti, but a hernia is different from what we're talking about. So that
an
will
umbilical hernia is like an
in your
outie,
belly button. Yeah.
belly
And it will
button.
kind of like pop out when you cough or laugh or
Okay.
strain, and so there you can measure diastasis with ultrasound, you can measure it with calipers, you can do the finger width and depth. So we look at the depth and see kind of how deep is this going, to kind of tell if that deeper core is able to engage. And sometimes we'll say, now we try to do the transverse abdominis engagement that we taught you, and you kind of like push my finger out and the whole thing closes, and you're like, okay, actually you can sort of restore this. But we're not as focused on closing the gap. Like 15 years ago, that was sort of the notion, was we got to close the gap. And that's really fallen out of favor with PTs at this point.
It doesn't matter so much
as function and form and quality of life and true strength, because you actually can have great strength and mobility and still have a little bit there,
Yeah. So that's one of the things that actually brought me to a PT, to see about trying to fix this. What you mentioned with, I was having more back pain, like lower back pain.
Yep.
And so that's sort of what brought me in.
Yeah. And a lot of times, if you think about the phase of life that people are in when this is happening, is that they're sitting for hours on end trying to like contort themselves to feed their baby, and in this like hunched posture, and they're recovering from this massive, a lot of this physical change, hip hike.
Yeah, exactly. So
and then and then sometimes people have pregnancies close together, so they're during the period that you may be pumping or breastfeeding, your estrogen levels are decreased. And so you're not really getting that tissue healing and that elasticity that you have when your estrogen levels are back up. And so then we maybe finish nursing or pumping and then jump right into another pregnancy. So it's just one of those times in life where our core gets a lot of kind of a beating and doesn't necessarily get a ton of rehab. And I do feel that when I look at social media, I sometimes feel frustrated by the conversation around diastasis recti, because I feel like, it makes people afraid to move, and it makes people really afraid to resume exercise. And so
the idea is that if they do it wrong,
yes, or the wrong exercise. And I don't think there really is a wrong exercise. It may be more so about you knowing how to modify an exercise and also knowing when to progress. So of course, tissue change, muscles grow when the challenge is enough for them to grow. And then they get injured when the challenge is more than what they can handle.
Right.
So it's a little bit nuanced. It's like, somebody might be listening hoping, oh, Alex will just tell me to do marches and bent knee follows and heel slides. But that's not really how it works. You have to look at a person's individual body and see what are they capable of now? What are their breathing mechanics like? What is their rotation and flexibility look like? And how is their pelvic floor supporting them? Is their diaphragm still stuck up under their rib cage, which it
Mhm.
oftentimes gets that way after you're pregnant, because your baby sort of takes up all that space and then your breathing muscle, which is your diaphragm, sort of gets pushed out of the way. So a lot of what we do is actually get under there and help it mobilize and bring it back
Yeah.
down. And then suddenly you can like actually get to the end of your exhale again.
Uh-huh. This is so interesting because, even though I had the PT who, said, "Oh, I don't think there's anything we can do about this." And maybe there wasn't. I mean, maybe it was mild enough. Maybe what she was saying is, um,
Your core looks
"Your
great
core
already.
looks
Yeah.
great
Hmm.
already." She didn't say that, but
Yeah.
that may be what was going on.
Hmm.
But I had this really wonderful bar instructor,
Oh,
and I
good.
went
Yes.
to her class. It was like a baby bar
Hmm.
class.
Yep.
I started going then. Jessica Diaz, she's a
Mm.
local in
Cool.
our community, um, is amazing. And one of the things that she was so particular about,
Hmm.
well, form, first of
Yep.
all. She was constantly coming around and
Correcting.
correcting form, which I loved,
Yeah. So you're doing it right.
you
Yeah.
know you're doing it right. Really, about breath.
Yeah. Breathing.
And then the other thing is that she wanted you to do the form right. And so she had me when I started coming back to this, I was doing a lot of trying to
Mm.
do the core at the highest
Yes.
level,
No, no,
right?
no.
At the
Yeah.
highest progression.
Hmm.
And she had me in a lot of, in bar and Pilates, you do a lot of the like hollow
Oh,
holds
yeah.
and
Yeah.
stuff like
Hmm.
that. But
Which I don't like.
I
Yeah.
know you don't
Hmm.
like, but she had me hold on
Yeah. Yeah. Good.
for years. It felt
Yes.
like years
Hmm.
because I couldn't actually feel my abs at all.
Yeah.
I think I
You
was
weren't
going
connecting with your
I
deep core.
wasn't.
Yeah.
No, and it wasn't until I started reconnecting with the deep
Mhm.
core that I actually was like, "Oh,
Oh,
now this
yeah.
feels like it's
Mhm.
doing
Yeah,
something,"
right.
you know?
Totally. And sometimes I think we do scale it way back just to get the mechanics right, So
Mhm.
people will say, "Wow, this looked so easy, but when I did it, it wasn't easy at all." And it's like, yeah, because we actually scaled it to the point where you are connecting with that transverse abdominis. We're getting those obliques, understanding what each muscle's role is in the process, doing some of the deep multifidi in the back and all that. And then what we really want to look at is how it all works together,
Mhm.
because if we're, for example, I would say somebody that maybe isn't in a class or with a therapist is just crunching, crunching, crunching at home. That one motion is one of many that the core
Right.
actually does. And then unfortunately when they're saying, don't twist, don't do any, I feel like we actually do a
A lot of
disservice to
twisting.
people. Yeah, that we do
Yeah.
such a disservice,
Yeah, yeah, yeah.
and we really want to regain their postural muscles too.
Mhm.
And so I do feel that in a quote unquote, I was going to say good, but I think I'll just say thorough instead. We look at the whole canister as a
Mhm.
unit and how is it all working together. And so sometimes people are shocked when we have them get off the table and do a standing pelvic floor assessment because it's kind of as awkward as it sounds. We're literally having them stand there with our,
Yeah,
internally
yeah. Yeah,
assessing
yeah.
and
Are you
with consent, of course. But
Oh, of course.
yeah, and so
You're, like, squatting down next to
yeah,
them. Yeah, yeah,
literally.
yeah.
And but it can be completely different when you get off the
Of
table,
course, gravity is
And
a
so
powerful
yeah, so
force.
so so if you're only doing core laying on your back, that's not really where your core functions. So we do a
Yeah.
lot of standing core exercises,
Mhm.
We'll have the bands, we'll have all that. So I do feel that certainly diastasis recti is a very controversial topic in physical therapy. Part of that is because the research is mixed and some of it isn't good quality, and I
Mhm.
think also we're trying to be excellent. We're trying to be at the forefront of rehab in general, and we kind of need to bust the myths,
Mhm.
but without good qualitative research and quantitative research, it's hard to say,
Yeah, yeah, yeah. It's hard to say this is the thing that really works well
Yeah,
if you don't
exactly.
have that good research to back it up. Other than that, it's just sort of opinion.
Yeah, and I think the bottom line is that conservative management with an exercise program that focuses on mobility, breathing, the whole canister, looking at the different muscles, especially the deep core, is reasonable to say that that is helpful and works.
Mhm.
And then I think we also have to recognize that we don't work in silos. We have a team. So having people, go and meet with a hernia specialist and see kind of is this relevant? Do I need
Mhm.
to do anything about it or not? And so we belong to several different groups. Pelvic Global is one of them, and they'll have a hernia surgeon come in and talk to us. So I think our field is trying to become less siloed and trying to work within the medical community,
Mhm.
and having maybe somebody that does abdominoplasty come in and discuss what that looks like, and what can you actually do in terms of core rehab after that surgery takes place and all that.
Mhm.
So I feel that we are trying to do a good job to realize that we're not the end all be all, and
Mhm.
also be as comprehensive as we can be. But this is one of those topics that gets people pretty heated.
Yeah, yeah, yeah. Interesting. That feels like real, like, nerdy.
Nerdy, yeah, because
Yeah,
there's
it's like
nuance to it.
it's nuanced, but I don't know that the general public would be at all in tune with that nuance.
No, and then unfortunately, they just listen to the TikTok influencer that's like, "Don't do any Russian twists," and it's like, you know what? You're not wrong. If
Yeah.
you're 6 weeks postpartum, you probably have no business doing planks and Russian twists,
Mhm.
but how can we get you there? It's not like
Yes, I
never
see.
do them for as long as you live. It's let's start where you are.
Okay. So, I'm imagining someone who maybe is 6 weeks
Yeah,
postpartum,
mhm,
and their baby's napping,
yep, and they
and
wanna do
they
something.
wanna do something. Maybe they don't have, they're feeling okay. They don't
Yeah,
feel like they need to come to a PT,
yeah.
but they don't wanna do anything wrong. They wanna do something.
Yeah, I'll tell you what I
Yeah.
did, and I
Tell
think
me.
and I think I started it before 6 weeks, so
Yeah,
for what it's
I
worth.
did too.
But I would put my fingers right in the hip crease,
Okay.
deep in that hip crease, like, so if your belly button's in the middle, your
Yep.
fingertips are kind of, and then go
Okay.
ahead and just dig them in there and turn on that muscle under your hips. I'm gonna find it for you, like, right there.
Oh, yeah.
You feel that?
Yeah, I
So
feel it.
do, like, if you're listening, do a little cough or a huff, and you
I'm not gonna
feel
cough
no,
into the
no,
mic,
not
but
into the mic, and there you go. Did you feel how you just
I
laughed
did.
and you
Yeah,
felt
yeah,
it?
I did.
Okay. When you laugh
It
and
sort of pushes
that's
out.
your transverse abdominis. It
Okay.
pushes out, it becomes firm.
Yep, I
The
feel it.
mistake that a lot of people make is sucking in. When you suck
That's why
in,
you don't like to
nothing
have a hold.
happens. Yes. When
Okay.
you're sucking in, there's no core
No.
activation.
Okay, so
You're
you're
just sucking in. And the worst part about it is a lot of people breathe in and then suck in.
yeah.
What the hell is that? That is nothing. That is ridiculous. And then
Alex is getting heated now.
that's why the cues of like, oh, suck in like you're putting on tight jeans.
No,
No.
don't do that.
Because feel
Yeah.
this is broadening. This is
Right.
thickening.
Yes.
So you're
It's
you're
literally, like,
activating.
puffs out.
Yes.
Yes, okay.
So it's
I
kind
feel
of
it.
like the opposite.
Yeah.
And so what I would do is I would do a big deep breath in, and then I would exhale and activate that muscle. I'm trying not to do like a long exhale on the mic, but so
Okay, I feel it. Yep.
and then you would hold it for the full exhale, and then you would let it go. And your pelvic floor naturally engages with that as well. So you're sort of healing your pelvic floor with this whole process, because the
Yeah.
transverse abdominis works with the pelvic floor.
Okay.
And then once I was comfortable with that, I would add a little movement of my legs. I would add a long lever. So what that means
Were
is
you standing? Were
no,
you
laying
sitting?
down.
Laying down,
And
okay.
so once you sort of get that sensation that, yes, you are activating, we're talking really early postpartum now.
Mhm.
So that's why I'm not doing some of the more complex. But it's like, can I lift and lower one leg without my pelvis bobbling from side to side? Can I engage that core and lift the other side? Can I bring one knee out to the side and bring it back in without the opposite pelvis lifting? Can I slowly slide a heel down and back up without my back arching? And meanwhile, we have a natural lumbar lordosis, which is like a curve in our back. It's supposed to be there.
Mhm.
So I'm not asking people to press their back flat against the floor as hard as
Oh,
they
how
can.
many times have I heard that? Have
I
all heard this.
know.
You know what? This is changing, though, where
Yeah.
people, maybe it's just the
Like keep your
instructors
natural
go
curve.
to,
Yeah.
but they're like, "Your back is supposed to have a natural
Yeah.
curve. It's okay." But
Totally.
that press your back
Oh,
against
used to
the
be everywhere
used to be everywhere.
and sometimes still is. And so
It's
that
okay for
is
your back to have a little curve. That
just a
doesn't mean
small
you're doing
curve.
it wrong.
Correct. And then,
Okay.
but if you feel like it's getting more as you're doing the exercise, take your leg a little less far,
Okay, yeah.
And so meanwhile, your heel is still on the ground.
Mhm.
You're sliding your heel along the ground. And so then as we progress, then of course we get into a more gravity dependent position, like on hands and knees.
Mhm.
Can you pull and engage properly with gravity kind of pulling you down? And then we get into an upright position.
Mhm.
Absolutely. So this is
But it's all about this transverse abdominals, and a really good way to find that is to
touching it.
feel
Hmm.
it's right underneath your hip, sort of like in the
Yeah, the
side
hip
of your
crease. Yep.
pelvis
Hmm.
and the hip crease, and you can
Yep.
cough or laugh. I
And
mean, I
huff.
felt it
Mhm.
immediately.
Yeah, and I've had patients who need to kind of huff at the beginning of every exercise
Uh-huh.
just to get it to
Just to
turn
get it.
on,
Yeah.
because your brain, because these muscles stretch out so much, your brain and your muscles disconnect. They kind of
Mhm.
they lose that. Sometimes I'd say it's more like we're just getting these muscles back online. You think
Yes.
about the pelvic floor, it stretches 250 times its normal length in vaginal delivery.
It's amazing.
And so you really have to just get it back online. It's so stretched out. We're trying to engage. And then, of course, there's nuance in everything. There's plenty of people who the muscles are like, what just happened to me? And they spasm and get really tight too.
Mhm.
So if it's super grippy, we might do manual therapy to release, and we might just do the breathing to expand it. So I think it's hard to oversimplify these topics, but I would be safe and comfortable to say that what I just expressed is a reasonable thing to do early postpartum.
Yeah. And
And
the
then thread the
way
needle. Sorry to interrupt you, but
Yeah,
like
no,
just
that's okay.
I would never be doing core stuff without also focusing on my restoring my mobility.
Yeah, that's important too.
So
Yeah.
like on hands and knees, you open up to the side, get your
Yep.
pecs, and then you thread under, and then you kind of take a couple breaths into your
Mhm.
back,
Mhm.
because breathing into your back is a really nice way to get it to you know,
It also feels
move.
really
It
good.
feels really good
It
and get
feels
it to
really
move
good.
again.
Yeah.
I'm sorry, what were you gonna say?
I was just gonna say that for folks who are listening as opposed to watching
Mm.
this, one of the things that you may have missed, the little nuance, was that as you were talking about the exercise, you were really modeling the breathing.
Yeah,
This
the
is
breathing.
really
Yes,
slow, that you're actually breathing the whole time. So actually, this is just as important to tend to your nervous system as you're tending to your like we
totally.
want to be like, let's do some abs,
Yes. And there's
get
this
that flat belly,
yeah,
which I know you hate
I
as well.
do, yeah,
Yeah.
and there's this kind of, like, bucket handle thing sometimes, like, to try and take a deep breath. Our rib
Right. You're
cage kind of
like,
flares up,
yeah.
and really, I wanna think about 360-degree breathing, so thinking about breathing into your lateral ribs, like, out on the
Mhm.
side, and breathing into your back,
Mhm.
and not just kind of, like,
Yeah.
expanding that way. So we hold the sides, and we
In a way that that is gonna feel, one of the things I think that people often think of when they're doing this kind of lateral breathing is it's similar to belly breathing.
yes,
So,
so
breathing into your belly, you're also expanding your ribs.
yes,
Yeah.
exactly. Because I think when people are just breathing into their belly, they sort of end up
Yeah,
yeah.
moving their
Yeah,
chests up
yeah,
and
yeah,
down more,
yeah.
so you're really thinking not just
Like a
it's not the
circle,
front of
yeah,
your belly, it's
like
the
360 degrees, yes.
yeah, and it flares out your bottom ribs
Right, and
a
so
little bit more.
and then also then you knit them back together, which a lot
Right.
of us with that postpartum rib flare, we kind of round our shoulders to try
Yeah.
and whatever, but I will say that I'm sure there will be a listener out there. There's a lot of upper ab grippers. So if you're noticing that you're gripping your upper abs and pooching out the lower belly,
Mhm.
that is a time where I would actually really encourage you to get in between your ribs and massage and relax that
Mhm.
area,
Mhm.
and maybe focus all the more on the lateral and the back expansion.
Mhm.
Because I do find that people will be like, oh, it just still looks like I'm pregnant. And what they're doing is they're gripping their
Gripping.
upper abs and pooching out the bottom,
Yeah.
So that can be a troublesome problem as
Okay, yeah,
well.
because those lower abs are hard to
And
get,
that's the
definitely.
transverse
Yeah.
abdominis. Yeah. And so
Yeah.
if you're like thinking about that nice long posture and you're engaging in the lower area, that's probably a way to get out of that upper ab gripping.
Yeah. Okay, so one last question for you,
Sure.
which is that, a lot of the people that I work with, I
Yeah.
hear pretty often, I do work with people who are directly postpartum, but a lot of times people come for their relationship once
Yeah.
their kids are a little bit older.
Older. Yeah. When they have
Uh-huh.
time to
They
breathe
have a
and
little
think
bit of
about each
time.
other again. Yeah.
Exactly, and so one of the things that I hear a lot is now that my kids are a little bit older, I wanna I've got some stuff that I need to
Take care of.
take
Yeah.
out,
Mm-hmm.
take care of, yeah, exactly, and I think that some of that is just general physical fitness,
Mm-hmm.
but some of it is PT related,
Yes.
pelvic floor PT,
Mm-hmm.
ab stuff that is
Yeah.
sort of people don't have the time immediately postpartum, a lot of people don't have the
Yeah.
time.
Especially because there's no routine, really. People
No,
try and make a routine, and some babies do, but not a lot.
it's
Yeah.
hard, it's really hard, and then life gets busy.
Yep.
And so if you're not someone who has sought out these services, so
Mm-hmm.
sometimes if people have a traumatic birth or they're experiencing a lot of pain, they will come to you.
Yes.
But I think a lot of people would really benefit. I mean, wouldn't it be nice if this was just part of,
Yes. As it is
aftercare?
in other countries. Yeah.
Exactly.
Mm-hmm.
But be that as it may, imagine somebody whose kids are, 3 years old, 5 years old, 10 years old. Is it too late? I mean, the advice that I was given,
I
it's too
summarily disagree with the advice that
okay.
you received,
So tell me
summarily.
why. Tell me why.
Because muscles can change at every age and stage. I have had patients that are
Mhm,
85, 80, 100 years old. I mean, my oldest patient was 100 years old.
mhm.
And I write about a theoretical patient in my book, but um, the person that I think of when I write about that story, I mean, this woman was having more sex than me in her 80s. I mean,
Yeah.
come in the kitten heels and
Oh,
yeah, she was living life on Revere
yeah.
Beach.
Yeah.
And I just feel like we pigeonhole and think that it's too late. It's never too late. Of course,
Mhm,
think
mhm.
about any other muscle in your body.
Agreed, I agree.
Yeah,
It didn't
100%.
feel I mean, it felt I was kinda like, "Oh, okay."
If we're talking about cosmetic stuff, I mean, maybe like, yeah, is it the skin? Yeah, you're just going to have loose skin.
Yeah, yeah.
Like,
But that's
sure,
not like a
but that's
late
not,
that's
yeah.
just
And
like you have
also,
some babies and
yeah,
yeah.
exactly. My skin and my, it's looser than it was before
Sure.
kids. And I'm not
You
going to
stretch that
change
out.
that.
No.
And I'm not worried about that in the slightest.
Mhm.
But the core underneath it is malleable because it's a muscle and
Mhm.
muscles respond to the load that's put on it.
Yeah.
Yeah,
Okay, so it's not too late.
certainly not.
Not too late. And I think that the thing one of the things that I like to say to myself
Yeah.
and sometimes other people, I don't know if they appreciate it as
Mhm.
much, but it's like, well, age was gonna make the skin droopy anyway.
Oh, yeah.
One
Totally.
way, it's
I
like
know.
the boobs,
Yeah.
the
Oh my
skin, it was
gosh.
gonna go one way or the other.
Totally.
Gravity's taken a toll.
I know.
And so I got, you get the
Yeah.
babies out of it.
Yeah,
It's like it's to a
absolutely.
good cause. But it is hard to, I think the cosmetic piece of it is often what people are thinking about. There's this bounce back culture, which we've done a whole episode on. It is problematic in some ways, but I do think that it's one of the things that sometimes gets people in the door to work on
Yeah, they come for
their
more of an
abs.
aesthetic reason, and then they realize the functionality is
Yeah.
far and away beyond what,
Mhm.
because you know how I feel about
I
the.
know.
And I think so much of it is external influences. Like, I want people to
Yeah.
really come home to their true essence of who they are and, who they even were as kids before the
Mhm.
world told them who they should be and how
Yeah.
they should look. And this is one of those areas that just absolutely drives me crazy because the flat that it's not even physiologically natural.
Mhm.
Like that
Mhm.
isn't actually how we're supposed to look.
Mhm.
So I don't know why we're striving for it. Well,
Right.
I do because it makes money. People make money off of it,
Yeah. Yeah.
because it's an unattainable look
Right.
unless you get liposuction and abdominoplasty and
Right.
live
Which
in the
people do.
gym.
And
And people
sometimes
do. Yeah,
yeah.
absolutely. And so the big thing here is that I think you can always change your muscles and that the functional strength that you gain from that. And one thing I really admire about my mom, which I've shared, is that, she's in the gym every day to
Mhm.
crawl around with the grandkids.
Yeah.
So she wants to be able to hike Crowpatrick in Ireland. And they're in Italy right now and they're walking thousands and thousands and thousands of
Yeah.
those old cobblestone steps in the medieval villages. And she wants to be able to do that stuff. And that's what I think is,
Yeah, it's very
yeah,
admirable.
yeah,
The functionality.
totally.
Yeah.
Well,
Okay.
thank you so much.
Thanks, Alex.
Mhm. Thank you for listening to Under the Hood. If you liked this episode, please take a minute and leave us a review. And we'd love to hear from you. If you have any ideas for future episodes, please let us know.